Welcome back to Takacs McGinnis Elder Care Law Hour. And in this show, we're talking about resources that you may not be aware of. And I'm Tim Takacs.
And I'm Barbara McGinnis. In this segment, we're going to be talking with someone from our office about a hot topic, something that you need to know about: Medicare and Medicare prescription assistance. Welcome Joshua Hunter, who is a public benefits specialist at Takacs McGinnis.
Thank you for having me.
Yeah, good morning. So talk about these Medicare low-income subsidy program things.
Yes, so the Medicare low-income subsidy, we usually hear about it called Extra Help.
Okay.
It's a service that comes from Social Security, and simply put, it's awesome if you have somebody who is low income and low resource and they need some help with their prescription coverage.
Okay, it covers prescription drugs.
Kind of, sort of.
It pays for them, or they just show up in your mailbox?
No, it's not quite that simple. I explain it as it kind of works like a coupon. So you still have your prescription coverage through whatever company you have, may that be like Humana or SilverScript, but this help you get from Social Security limits what you pay for that. So it's either going to help with your premiums, it can help with what you pay at the pharmacy if you meet their, the criteria to apply for the program.
So how low income are we talking, Josh?
So for a single individual, I always tell people around $1,500. If you're even close to that,
a month,
that's right, $1,500 a month, and for a couple, it's almost twice that. So we're talking just right around $2,800, and we're going to look to see if we can apply.
Okay. Are there asset tests?
Yes, there are. There are asset limits to all of the programs I'll talk about today. So for LIS, it's around $14,000, and then $28,000 for a couple.
Married couple. Does it include the house?
It does not include the house. Thankfully, it only includes stuff that's like liquid, or if you have multiple. So if you have more than one car, if you did have more than one house, then they would look at those as additional. But the stuff you need to live day to day, your car and your home, thankfully are not counted.
So it sounds like a lot of people would qualify for that.
They do, especially here in Tennessee. A lot of people qualify for this help, and it can be a life changer. It can come in and really change somebody who's paying thousands in medications to next to nothing compared to what they were, a percentage.
Mm-hmm.
So how does someone enroll in that?
So the way you do it is meet with somebody, let them know what you have, and if you needed to apply, there are two ways to apply for LIS. So you can either apply on the Social Security website, and that's the best way to do it.
Or SSA.gov, right?
That's right. Or if you had to do it by mail, they do have a paper application where you can fill everything out and send it in.
Mm-hmm.
So that's the easiest way to go.
So that's one way to do it?
That's right.
Okay. Is there another way?
Really, those are the only two ways to go for LIS, because we got to get something to Social Security. So they either like it online or in paper.
Okay.
I believe you could do it in the office if you needed.
You could go to the Social Security SSA office, but maybe that's not a good idea.
No, that'd probably be the longest way to do it, I would imagine.
So check out the Social Security website to see if you would qualify.
That's right. They have a little search bar on their website, and if you typed in extra help or prescription coverage, it usually pulls that up pretty fast near the very top of their list.
Right.
And the application process isn't long at all. It's really not too hard, and you also don't have to supply anything with it.
Oh.
So it's pretty helpful that way.
Okay, so you go online and maybe on your phone or whatever it is, and you put in your information, and then what happens?
Put all your information in, and then once you apply, it's usually about 3 to 5 weeks before you get your determination. And then you don't have to take anything to your pharmacy or let your plan know. It's updated from Social Security through the rest of Medicare.
Okay, so then you go to the pharmacy and they look at your record and they say, okay, you're a Medicare. If you're on Medicare and Social Security, they have that record already.
They do, yeah, because it's billed through your prescription drug plan. You'll get there and they'll say your insulin's $8.50.
Oh my goodness.
You can blow somebody's hair back like that. That's awesome.
Right.
Yeah.
Okay. So what's a Medicare savings plan?
Yeah,
savings program, I should say.
The
MSP, Medicare savings programs.
The Medicare savings programs, they can be a little confusing to explain to somebody, but they are usually 3 programs that come from TennCare. So the first thing I want to say is it's not TennCare, but TennCare manages these programs.
Okay.
So we have QMB, which was always what we say is the best of the Medicare savings programs, and it has the lowest limits to
qualified
Medicare
beneficiaries.
Yeah, qualified Medicare beneficiaries.
Okay.
You'll always hear people say QMB.
Yes.
That's right. The other is SLMB, which is SLMB.
SLMB.
It's Special Low Income Medicare Beneficiary.
Okay.
Then you have QI1, which is Qualified Individuals, which is almost identical to SLMB. It's just that it comes from a different pot of money.
Okay.
So the way you'd qualify for those, I guess we'll jump right into it.
What do they do first? Why do I want to qualify for them?
Yeah, so Extra Help, as we had said, helps with your prescription coverage.
Right.
QMB or any of the other Medicare savings programs gets you extra help and can potentially help pay for things like your Medicare Part B premium and even the 20% that Medicare doesn't cover.
Okay, so
Wow.
it's directly out-of-pocket savings. Instead of paying money out for Part B.
Exactly.
Or
That's
something
right
like
back in
that.
your Social Security check. So that's
Gotcha.
$135 a month is your Part B.
Right.
Yeah.
And then the 20% Medicare doesn't cover. That means you wouldn't necessarily need a supplement. You could suspend your supplement and save however much that was costing you a
So
month.
that's why people want to get. That's why people need to know about these programs.
Exactly, because you could get help now with your supplement expenses, your Part B expenses, and your medications.
Dollars in your pocket.
Serious money. Yes.
Yes.
So
But
that
these
can be a great benefit.
qualifications, I bet, are even more stringent.
They are. So we'll start with
Okay.
QMB. It's the lowest, but it has the best total amount of help you can get.
Okay.
It's around $1,000 a month in income, or it ends up being about $1,400 for a couple.
Okay.
Now, thankfully, all the MSPs have the same asset requirements.
what's
the
Medicare savings programs? Yeah.
All three of them.
Okay.
And so it's around $9,000 for a single individual, and it's around $14,000 for a couple.
All right.
So sadly, it's not twice as much as you
and
would
you
like.
can still have a house.
You can still have your home. It works on the same rules as long as you don't have multiple things that they can count.
Gotcha.
Yeah.
The stuff you need to live, they're not going to hold against you.
Gotcha.
All right.
So, and the way you apply for an MSP, the good news is if you don't have either service, that's extra help or a Medicare savings program, you can do that same online application we talked about earlier and apply for both.
At Social Security
That's right.
SSA.gov.
Exactly. And so there's a little box that if you don't check it, they'll automatically send it to the state to apply for your Medicare savings program.
Okay,
That
so
takes about 45 days.
So LSI, low income subsidy, or as extra help,
That's right.
that's through the Social Security Administration.
Yes, sir.
And the Medicare savings programs is
Or
through
from
the
TennCare.
state,
That's exactly right.
the
So-
state Medicaid program.
Yeah, whichever state you're in, it's TennCare for us, and they handle that, and they usually take a little longer to process than your extra help application.
Okay.
Does different states have different requirements for those QMB, for those Medicare savings programs?
They can. Yeah, it
They
depends
can.
on kind of how they tackle, taking Medicaid in their
Yeah.
state. So
Okay.
usually QMB is pretty standard. It's around 100% of the federal poverty level, but the
Okay.
others and how they fluctuate really depends on where you live.
Yeah.
Got it. Got it. Do you have to reapply every year?
Well, not necessarily, but you do have redeterminations they can send you.
Okay.
And I wish it was every year. That would make it easier for people to prepare. But from what we've seen from experience, it can be every year, every 2 or 3 years. You just have to be ready to fill that out when you get it. It's a big packet you'll get in the mail. You'll know it when you see it.
Okay. So let's do a recap here. The low income subsidy basically helps you save on your medications.
That's right. Your Medicare Part D
Right.
premiums
Gotcha.
and expenses at the pharmacy.
Right, and then your QMB, your Medicare savings programs, actually puts dollars in your pocket.
That's right.
Because it means that Part B premiums, maybe other things that you would ordinarily have to pay, then those
Exactly.
programs will pay.
Direct money back. You got it.
Okay, direct money back. Okay, what if you earn too much to get these programs? All right, what about medications? They're still cost money.
Of course. Yeah,
How
medications
can you
still
get
be
help for
expensive.
those if you don't qualify?
Yeah, so there are a couple of prescription assistance programs out there. Some of my favorite to use include needymeds.com.
Needymeds.com.
That's great. So what that will do is you would search by the medication's name, usually whatever your most expensive one is,
Yeah.
and you would see if there's a prescription assistance program that's willing to help you pay for it. It just generates the list for you. It even tells you what those companies require and how to contact them to apply for their help. So let's say
Okay.
it's Johnson & Johnson helps with your insulin.
Gotcha.
You could give them a call and tell them your situation.
Okay,
Wow.
and all of these are bona fide. Needymeds.com.
Needy Meds and GoodRx are two.
GoodRx.com.
That's right. They're two very helpful ways to find some prescription assistance.
Okay, and so you're using those for our clients?
I sure am. If
Okay.
they don't qualify for any of this other type of assistance and they have really big meds, I always go to Needy Meds first, and we'll see if
Okay.
we can find something.
Gotcha.
That's my preferred.
Okay.
Well, we got 1 minute left, Josh. Anything important that we haven't said?
Yeah, one big thing I'm going to say is the easiest way to save money on your prescriptions is to take advantage of Medicare open enrollment. So that's coming up, or the annual enrollment period between October 15th and December 7th. If you want to make sure you're getting your drug plans at the best cost, make sure you're on the best plan to begin with.
Cool.
Right,
So
and
it's an easy thing to check.
right, exactly. And some of our clients are being helped, but they can go to the SHIP program. We've had those on before.
That's right.
So all right, so up next, we'll be speaking with the Tennessee Commission on Aging and Disability about the CREVAA program. So you want to stay with us to
find out
find
what
out what
that
that is. Thanks. Thank you, Bob.